The Rinderpest eradication on the African continent was actually a very big undertaking, not just by any individual, but a lot of countries had to come together, a lot of international organizations had to come in, donor community had to come in, and more importantly, for the countries on the continent, we needed a body to coordinate them, and that is how the Inter-African Bureau for Animal Resources came in handy in coordinating these efforts, and at the same time for advocacy and looking for financial support. And one of our most important partners who came in financially was the EC, European Union now, that has actually over a period of not less than 50 years supported the eradication process without wavering. And it's really been a big effort, and we really appreciate that effort. In terms of capacity building, much as I want to accept that Rinderpest eradication has been a big achievement and it's really what all these programs were looking at, personally I even have a different view, that in the sense that I even view the capacity building that has been done on the African continent through these projects that were eradicating Rinderpest as even a big achievement, because really what we have achieved in terms of capacity building for national veterinary services on the whole continent is a lot. Everywhere you go, at least the current, future, these projects really build capacity in terms of epidemiology, laboratory diagnosis, and a whole lot of anything to do with veterinary. It really build capacity on the African continent, and we're very proud of that. So yes, I accept main focus was Rinderpest eradication, but capacity building went hand in hand, and that is something that is going to live beyond the projects, and that's why I really put a lot of value to that aspect. The whole process, I would say, was not without its weaknesses or pitfalls. I remember very well in the days of PAC and also during PES, I think there was hand in hand with the eradication of Rinderpest, there's a lot of capacity building to do with financial management of resources, which those programs also had to look into it to make sure that the resources were financial resources were being well managed. Generally, coordination, how to run projects. It was a relatively new concept in most veterinary services, and accountability and what have you. So, as the project supported Rinderpest eradication and capacity building technically, it also the projects also supported technical capacities to manage projects, both from a financial point of view and just how to manage resources. AUIBA currently has the African Union policy to work with the regional economic communities, and this is in realization that those are actually the building blocks. Previously, IBA worked with member countries directly, but currently the direction is to work with these regional economic communities. But we realize that they are still weak. So a lot of emphasis now is going to capacity building for the regional economic communities, which should then go the next step of now supporting member countries in capacity building and strengthening of veterinary services. Yes, actually, through these programs for Rinderpest eradication, there's a lot of networking, both from a social point of view, but also, more importantly, from a technical point of view. We had networks, epidemiology networks, laboratory networks that brought together professionals from across the continent to really standardize the way they interpreted their findings, basically to support the control and eradication programs, which proved very beneficial. One very good example is that that of the epidemiology network that came in very handy in 2005-2006 at the height of HPAI. When HPAI was a threat to the world, for Africa, we really relied on the epidemiology networks that had been set up by PEST program, which had previously been specifically addressing Rinderpest. So these networks were very important in solving a lot of the animal health related issues, and they continue to be important even up to now. And we are currently promoting these networks to be able to continue assisting us as a means to controlling and dealing generally with other disease problems on the continent. The networks we established, first of all, maybe I should go a little further and say that these networks did not just link the various African institutions, they also linked African institutions with specialized institutions in the north. Like we had the laboratory networks that was linked to PubRite in the UK, CIRAD in France, and many other countries, IEA, all that. So really these networks are very good. And in the process also, the networks were useful in, have been useful in the sense that that has laid the foundation for the control of other diseases, you know, through the FAO, you know, FAO GREP, which has been actually dealing with the Rinderpest eradication globally. It helped to bring about global network, and I can see that we are going to continue with this network now to start addressing other diseases. Like FMD already is online, PPR is already online, and this has all been through the original networks that were created from the Rinderpest eradication.